Hello everyone, welcome back to Med-Surg Mentor. Today let's review a condition from the respiratory system, which is pulmonary hypertension. This condition occurs when there is a high blood pressure within the arteries of the lungs. Okay, let's get started. Definition of pulmonary hypertension. Pulmonary hypertension is a condition wherein the systolic pulmonary artery pressure exceeds 30 millimeters of mercury, or the mean pulmonary artery pressure exceeds 25 millimeters of mercury. Or in short, pulmonary hypertension is a condition of increased blood pressure within the arteries of the lungs. Next is etiology of pulmonary hypertension. Pulmonary hypertension is classified into 5 groups depending on the cause. And the first one is pulmonary artery hypertension caused by idiopathic causes, family history, congenital heart diseases, connective tissue disorders, HIV, and liver cirrhosis. And the second group is pulmonary hypertension caused by left-sided heart diseases such as left-sided heart valve diseases and left ventricular failure. Third group is pulmonary hypertension caused by lung diseases. And examples are chronic obstructive pulmonary disease, pulmonary fibrosis, and obstructive sleep apnea. Next etiological classification of pulmonary hypertension is pulmonary hypertension caused by blood clots. It occurs in conditions like pulmonary emboli and clotting disorders. And the last one is group 5 pulmonary hypertension, and it is triggered by other health conditions like blood disorders, inflammatory disorders, and metabolic problems. There is one more major congenital heart disease that can cause pulmonary artery hypertension, and that is Eisenmenger syndrome. In this condition, there is a hole in the ventricular septum which is called ventricular septal defect, and it results in mixing of oxygenated and unoxygenated blood. This blood then goes to the lungs instead of going to the rest of the body, increasing pressure in the pulmonary artery, causing pulmonary artery hypertension. Risk factors of pulmonary hypertension, and they include family history, being overweight, blood clotting disorders, exposure to asbestos, genetic disorders, living at a high altitude, use of certain weight loss drugs, use of illegal drugs such as cocaine, and use of selective serotonin reuptake inhibitors. Now let's move on to the pathophysiology of pulmonary hypertension. It can be caused by a variety of conditions like blood clots and lung disorders. Along with this, risk factors such as family history and use of various drugs can also contribute to the development of pulmonary artery hypertension. Additionally, vasoconstriction is also related to mediators like thromboxane and endothelin-1. The vascular obstruction is also responsible for an increased pulmonary pressure and endothelium injury. Thus, it leads to vascular scarring, endothelial dysfunction, thrombosis, and vasoconstriction. Gradually, it leads to vascular remodeling and increased pulmonary artery pressure due to increased pulmonary artery resistance. Ultimately, it results in pulmonary artery hypertension. Major clinical features of pulmonary hypertension are shortness of breath, fatigue, dizziness or fainting spells, chest pain or chest pressure, swelling in ankles, legs, and eventually in the abdomen, which is called ascites, cyanosis, and heart palpitations. Common diagnostic measures done to rule out pulmonary hypertension are blood test, chest X-ray, ECG, echocardiogram, right heart catheterization, CT, MRI, pulmonary function test, polysomnogram, ventilation perfusion scan, open lung biopsy, and genetic test. Among this, right heart catheterization is done as a confirmatory test to diagnose pulmonary hypertension. In this test, pressures can be identified directly by inserting a catheter. Major complications of pulmonary hypertension are cor pulmonale, blood clots, arrhythmia, bleeding in the lungs, and pregnancy complications. Medical managements of pulmonary hypertension include the following drugs: vasodilators, guanylate cyclase stimulators, endothelin receptor antagonist, calcium channel blockers, anticoagulants, digoxin, diuretics, phosphodiesterase 5 inhibitors, and oxygen therapy. Surgical managements of pulmonary hypertension. They include pulmonary endarterectomy, balloon pulmonary angioplasty, atrial septostomy, and transplantation. Let's see each one in brief. Pulmonary endarterectomy is a surgery to remove blood clots from the pulmonary arteries in the lungs, whereas balloon pulmonary angioplasty is a procedure in which a balloon catheter is guided into the arteries and inflated for a few seconds to push the blockage aside and to restore blood flow to the lungs. Third procedure is atrial septostomy. A small hole is made in the wall between left and right atria of the heart using a cardiac catheter. It reduces the pressure in the right side of the heart so the heart can pump more efficiently and the blood flow to the lung can be improved. Fourth procedure is transplant. In severe cases, a lung transplant or a heart lung transplant is done, especially for younger people with idiopathic pulmonary artery hypertension. Some of the preventive measures of pulmonary hypertension are: stay active, get plenty of rest, do not smoke, reduce sodium intake, monitor fluid intake, avoid exposure to air pollutants, eat healthy and manage weight, and avoid alcohol intake. Next is nursing diagnosis for patients with pulmonary hypertension, and they include decreased cardiac output related to arrhythmias secondary to pulmonary hypertension, acute pain related to increased strain in cardiac muscles, impaired gas exchange related to decreased lung perfusion, ineffective breathing pattern related to ventilation perfusion mismatch, activity intolerance related to fatigue, knowledge deficit regarding disease condition, fear and anxiety regarding uncertain outcome, and risk for bleeding related to anticoagulant therapy. Important nursing cares for patients with pulmonary hypertension are: assess vital signs, tissue perfusion, heart sounds and lung sounds, administer supplemental oxygen and analgesics, educate patient on relaxation techniques and stress management, ensure bed rest to the patient, advise to avoid heavy lifting and prolonged straining, teach deep breathing exercises, encourage smoking cessation and avoid exposure to pollutants, avoid situations that excessively lower blood pressure like sitting in hot tub, and advise to avoid travel to high altitudes. With this, we are finishing the review of the condition pulmonary hypertension. It is a condition with increased blood pressure within the arteries of the lungs. There are 5 etiological classifications, and we have also discussed definition, etiology, risk factors, pathophysiology, clinical features, diagnostic measures, complications, management, nursing diagnosis, and nursing care. Thank you so much for watching, and if you find this video helpful, please like, share and subscribe to my channel. Thank you.